Hello and welcome. Today, we're diving into the world of respiratory health to explore a condition known as hemothorax. Hemothorax, simply put, is the accumulation of blood in the pleural space, the space between your lung and the chest wall. Understanding this condition is crucial for prompt diagnosis and effective management. So, let's begin our journey into the complexities of hemothorax. So, what causes blood to accumulate in this space? The etiology of hemothorax is quite varied. Trauma, whether it's blunt force like a car accident or penetrating injuries like a stab wound, is the most common cause. However, non-traumatic causes also exist. These can include complications from thoracic surgery, pulmonary infarction, bleeding disorders such as hemophilia, malignancy involving the pleura, ruptured blood vessels, and rarely, even spontaneous occurrences. Essentially, any condition that damages blood vessels in the chest cavity can lead to hemothorax. To understand hemothorax, we need to consider its pathophysiology. When blood enters the pleural space, it disrupts the normal negative pressure that keeps the lung expanded. This accumulation of blood can compress the lung, hindering its ability to inflate fully. The compressed lung results in impaired gas exchange, meaning oxygen intake and carbon dioxide removal are reduced. This can lead to respiratory distress and hypoxia. Moreover, if a large volume of blood accumulates rapidly, it can also lead to hypovolemic shock, as the body's circulating blood volume decreases. The blood itself can also irritate the pleura, causing inflammation and potentially leading to complications like empyema, an infection of the pleural space, if not addressed promptly. In terms of epidemiology, hemothorax is relatively uncommon in the general population, but its prevalence increases significantly in specific situations, particularly following trauma. It's more frequently observed in emergency departments and trauma centers. The incidence also varies based on factors such as age, pre-existing medical conditions, and lifestyle choices that increase the risk of trauma. Certain occupations, such as construction work or military service, can also elevate the risk due to increased exposure to potential chest injuries. While precise numbers are difficult to pinpoint due to varying reporting practices, it is safe to say that hemothorax represents a significant clinical concern in the context of trauma care and thoracic surgery. The signs and symptoms of hemothorax can vary depending on the amount of blood in the pleural space and the speed at which it accumulates. Common symptoms include chest pain, often described as sharp or stabbing, and shortness of breath or dyspnea, which becomes progressively worse as the lung is compressed. Other symptoms may include rapid heart rate or tachycardia, rapid shallow breathing or tachyon anxiety, and pale or clammy skin. In severe cases, signs of shock may be present, such as decreased blood pressure, altered mental status, and loss of consciousness. It's important to note that these symptoms can also be present in other conditions, so a thorough evaluation is crucial for accurate diagnosis. Diagnosing hemothorax involves a combination of physical examination, imaging studies, and sometimes fluid analysis. A doctor will listen to the lungs with a stethoscope, looking for decreased or absent breath sounds on the affected side. Chest X-rays are a primary diagnostic tool, revealing the presence of fluid in the pleural space. A CT scan of the chest offers a more detailed view and can help identify the source of bleeding or associated injuries. In some cases, a thoracentesis, a procedure where a needle is inserted into the pleural space to withdraw fluid, may be performed to confirm the presence of blood and rule out other conditions, such as pleural effusion. While hemothorax isn't strictly classified into types, its presentation and management can vary based on the size of the blood accumulation and the underlying cause. We often talk about small, moderate, and large hemothoraxes based on the amount of blood present. Acute hemothorax refers to a recent accumulation of blood, while chronic hemothorax describes blood that has been present for a longer period. The approach to treatment is tailored to these factors. Treatment and management of hemothorax aim to remove the blood from the pleural space, restore lung function, and address the underlying cause of the bleeding. The initial step often involves placing a chest tube, a tube inserted through the chest wall into the pleural space to drain the accumulated blood. In some cases, especially with smaller hemothoraxes, the blood may be reabsorbed by the body over time. However, larger hemothoraxes or those with ongoing bleeding typically require more aggressive interventions. Video-assisted thoracoscopic surgery, or VATS, is a minimally invasive surgical technique used to remove clots and repair bleeding vessels. In rare instances, open thoracotomy, a more extensive surgical procedure, may be necessary. In addition, addressing any underlying bleeding disorders or managing malignancy is crucial for long-term success. Preventing hemothorax largely depends on preventing the underlying causes. Injury prevention measures, such as wearing seatbelts in vehicles, using appropriate safety equipment in workplaces, and avoiding high-risk activities can help reduce the risk of traumatic hemothorax. For patients undergoing thoracic surgery, meticulous surgical technique and careful post-operative management are essential to minimize the risk of complications. Managing bleeding disorders effectively can also reduce the likelihood of hemothorax in individuals with these conditions. The prognosis for hemothorax depends on several factors, including the underlying cause, the amount of blood in the pleural space, the patient's overall health, and the promptness and effectiveness of treatment. In many cases, with timely and appropriate intervention, patients can make a full recovery. However, complications such as empyema febrithorax, a scarring of the pleura, and chronic lung dysfunction can occur if hemothorax is left untreated or is poorly managed. Current research focuses on improving surgical techniques, developing new strategies for managing bleeding, and exploring ways to prevent complications. Studies are also investigating the potential role of novel therapies, such as fibrinolytic agents, in accelerating the resolution of hemothorax. By continuing to advance our understanding of this condition, we can improve outcomes for patients affected by hemothorax.